What's up? I'm Hutch, and you need to understand visual anatomy so that you can better treat your patients and also pass the NPTE. Vision plays a huge role in our balance system and can often lead or correlate with vestibular problems. Your retina converts light into signals that are sent via the optic nerve. So if you have a lesion at the optic nerve, you're not going to be able to see anything, also known as ipsilateral blindness. The optic nerve is made of two sections. The temporal retina on the outside sends information about your central visual field to the half of the optic nerve that originates from and stays on the left side of your brain. The nasal retina, which is on the inside, sends information on your peripheral vision to the half of the optic nerve that will cross to the other side of your brain at the optic chiasm. A lesion at the optic chiasm would affect those crossing nasal portions of the optic nerve, and it would reduce your peripheral vision, also known as bitemporal hemianopsia. Moving posteriorly from the optic chiasm, the optic tract includes the left temporal portion and the right nasal portion that came from the eyes. A lesion here would reduce the left central vision and the right peripheral vision, so basically the right side of both eyes is reduced. This is called homonymous HEMIANOPSIA. The optic tract splits into a bunch of radiations, which finally brings all of that information into the occipital lobe of the brain, which is the vision center. A big injury like a stroke or a TBI can affect this vision center of the brain and cause cortical blindness. This means that although there is no damage to the eyes themselves, you'll not be able to see anything because your brain can't process the information that it's getting. A smaller lesion can cause quadranopsia or quadrantonopia, where a quarter of the visual field is lost in both eyes. Other visual deficits like myopia, which is nearsightedness, or hyperopia, which is farsightedness, and even astigmatisms can be fixed via surgery because they have a lot more to do with the actual shape of your eye. Glaucoma involves an increase in pressure on the optic nerve, which results in progressive peripheral blindness. Macular degeneration involves leaky blood vessels, which can cause progressive central blindness. Cataracts is a clouding of the lens due to aging, and that can be surgically fixed pretty easily. Ptosis is one eyelid tends to droop a little bit more, and that can be due to a stroke, a neural lesion, or even genetics. Diplopia is basically double vision, and this can be due to nerve or muscle damage, and it's a common symptom of vestibular or central problems. Oscillopsia is another symptom that you may hear about, which is when the world appears wavy. And this is usually due to a loss of the vestibulo-ocular reflex, which I'll talk about more in another video. Now it's time for NPTE Jeopardy! Pause the video now if you want time to read and think about the question. Otherwise, you've got 5, 4, 3, 2, 1. Remember, the optic chiasm is a crossing of the nasal portions of the optic nerve, which produces the temporal visual fields, aka our peripheral vision. Hopefully that covers all of our bases. If not, you can always check out the description box below for a link to my notes on Etsy, or you can drop a comment with questions or suggestions for videos I should do in the future. Otherwise, good luck studying and go change the world.